Are you curious about the available treatment options for MOG antibody disease? Whether you're diagnosed or a caregiver, this video is your essential guide. Today we're delving into some of the more common treatment options for MOGAD. We'll break down some of the different treatment options used to treat the condition, including the latest breakthroughs which could be used to treat MOG antibody disease later in future. MOG antibody disease is currently being treated in a number of different ways, depending on the aim of the person requiring treatment or their circumstances. If you are diagnosed with MOG antibody disease, you may want to be aware of some of the treatment options which could be available to you. In this video, we're going to be going through some of the more common treatments and how they are used to treat the condition. Firstly, there are two types of treatment for MOG antibody disease: acute and preventative. Acute treatments are given at the onset of a relapse or episode to stop it from continuing. Preventative therapies are long-term treatments aimed at stopping relapses from happening in the future. One important thing to note is there are currently no FDA or EMA approved treatments for MOG antibody disease. However, treatments approved for other conditions may be prescribed off-label. So let's start with acute treatments. Acute treatments for MOG antibody disease revolve around stopping antibodies attacking myelin in the central nervous system, and the primary aim is to stop active episodes from doing damage. The first acute treatment I'm going to be talking about is intravenous steroids, also referred to as IV steroids. A healthcare provider will likely treat an episode or relapse of MOG antibody disease with IV corticosteroids. IV steroids broadly reduce inflammation in the body and nervous system. This treatment is given through an IV or cannula into the bloodstream, generally for 3 to 5 days. The next acute treatment is oral steroids. IV steroids may be followed by oral steroids such as prednisone or prednisolone, generally for between 3 to 12 months. This treatment is taken via a tablet or pill, which are usually taken daily. When I was recovering from my MOG antibody disease episode, I was actually taking oral steroids for 18 months, with a dropping the dose throughout that time period. The longer treatment periods can occur. Persons should not stop taking oral steroids suddenly. The dosage needs to be gradually reduced before stopping completely. This is because when taking oral steroids, your body stops producing its own natural form of steroids. The body needs time to start making its own natural steroids again, so stopping suddenly may actually increase the chances of a MOG antibody disease relapse. Next, we have plasma exchange, also known as PLEX. Now, if IV steroids treatment is actually unsuccessful, a healthcare provider may consider using PLEX alongside steroids. PLEX is often considered when a person shows symptoms of severe demyelination. This treatment works by replacing the plasma in an individual's blood and then replacing it with other plasma or an artificial substitute. With this treatment, any inflammatory antibodies or proteins in the person's plasma are removed, and this includes anti-MOG antibodies. PLEX treatment takes several hours to complete and may require a number of sessions over the course of a few days. Now, for the last acute treatment, we have intravenous immunoglobulin, also known better as IVIG. In this treatment, antibodies from healthy donors are given to a person via an IV or cannula. These antibodies are made by the donor's immune system and help regulate the person's autoimmune responses. IVIG was used as a preventative treatment. Some healthcare providers have actually been experimenting with it as an acute treatment too, and so far the results have been promising. One key benefit of using IVIG as an acute treatment is that it avoids corticosteroids and the quite nasty side effects that they can have. Now let's move on to preventative treatments. While some people only have one MOG antibody disease episode, others may relapse. Often these people are put on preventative treatments in order to stop further relapses from happening. Preventative treatments usually focus on suppressing the immune system so that anti-MOG antibodies are no longer produced. The following treatments are found to have some success in preventing relapses. Firstly, we have IVIG, which is reported to have some success in preventing relapses. A retrospective study involving adult patients taking maintenance IVIG treatment concluded that it was associated with reduced relapses. However, further studies are required to confirm these findings. Next, we have subcutaneous immunoglobulin, also known as SC SCIG. SCIG has some potential advantages over IVIG, including the ability to self-administer the treatment at home, cost effectiveness, and lower risk of systemic adverse effects. One study showed that SCIG may be a highly effective treatment to prevent relapses in MOG antibody disease and may be considered as an alternative to IVIG. However, once again, additional studies are needed to support this. Next, we have azathioprine, also known as its brand name Immuran. Azathioprine is an oral treatment which is taken twice daily to suppress the immune system. The treatment requires blood draws before and during treatment to monitor the medication's effect on the body. Azathioprine has also been used to treat organ transplant rejections, rheumatoid arthritis, and other autoimmune disorders. Steroids may also be used in combination with azathioprine in order to prevent relapses and may bring additional complications. It's also worth mentioning that using azathioprine during pregnancy is not advised due to an increased risk of miscarriage and defect. Now, azathioprine is a treatment I took for around 20 months without the use of steroids. It is the first and so far only long-term treatment I have taken for MOG antibody disease. Whilst taking azathioprine, I did not have any issues with relapses, but I did have a few issues with infections, especially when increasing the dose to 75 milligrams twice a day from 50 milligrams. But whilst I was taking the medication at 50 milligrams twice a day, I actually didn't have any issues or side effects. Next, we have mycophenolate mofetil, also known better as its brand name Cellcept. Cellcept is another treatment which is taken orally twice a day to suppress the immune system. And similar to azathioprine, this treatment has also been used to prevent bodies from rejecting transplanted organs. Blood draws are also required before and during the treatment in order to monitor the medication's effect on the body. Cellcept is also unadvised to be used during pregnancy due to an increased risk of miscarriage and defects. Next, we have rituximab, also known as Rituxan. Rituximab is a treatment given via IV, suppresses the immune system by depleting a type of white blood cell called B cells. This treatment is required to be given 2 to 4 times each year. Whilst taking this treatment, monthly blood draws are also required to monitor the levels of B cells to ensure the treatment is working as intended. Rituximab is also reported to be safer when used in pregnancy in comparison to azathioprine and mycophenolate mofetil. However, planned pregnancy is still advised when using the treatment. Whilst this treatment may work for some people, new data suggests that its effectiveness is not as good as some other treatments. Now, let's move on to some investigational treatments. Due to MOG antibody disease not having any approved treatments, several clinical trials are ongoing to find beneficial preventative therapies. The next 2 treatments are currently being tested, and if successful, they could be approved to be the first MOG antibody disease treatment. Firstly, we have rozanolixizumab, or more commonly known as rozimab. Rozimab is a monoclonal antibody. The FcRn molecule usually preserves antibodies in the blood, stopping them from being destroyed. Blocking the FcRn causes antibodies in the blood to get degraded very quickly. It can drop an individual's antibodies by 70% in 1 day. Now, antibody levels will recover naturally, so this treatment needs to be taken weekly via a subcutaneous injection. Clinical trial for rozimab started in 2021 and is taking place across multiple sites and locations worldwide. I made a separate video about rozimab and the clinical trial, which you can check out using this link here. Next, we have satralizumab. Satralizumab is a monoclonal antibody designed to block the action of IL-6. IL-6 is a protein in the body which enhances inflammation. By blocking IL-6, this treatment is expected to prevent relapses from happening. Satralizumab is one of the first 3 FDA-approved treatments for AQP4 positive NMOSD, which is why it's now being tested to see if it can prevent relapses in MOG antibody disease 2. This treatment is given monthly via a subcutaneous injection into the belly or thigh, and the clinical trial to test this treatment started in 2022 across multiple locations and sites worldwide. If you want to find out more information about the satralizumab clinical trial, then check out this video here.